Hi, I'm Peter Glowicki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. On behalf of the editors and staff of the JVS publications, let me wish you first a happy and healthy new year of 2019. I am pleased to introduce to you the best papers of the January issue of the Journal of Vascular Surgery. The Editor's Choice article is also our CME article this month. It is entitled Trans-Carotid Artery Revascularization versus Trans-Femoral Carotid Artery Stenting in the Society for Vascular Surgery Vascular Quality Initiative, authored by Dr. Mahmoud Ballas, still from Johns Hopkins Bayview Research Center at the time this manuscript was written in Baltimore, and his colleagues from multiple institutions in the United States. This VQI study compared outcomes of 638 patients who underwent trans-carotid artery stenting, the TCAR procedure, with 10,136 patients who had transfemoral carotid artery stenting. After TCAR, in-hospital stroke and TIA occurred in 1.9%, and stroke, TIA, and death combined occurred in 2.2%. After transfemoral carotid artery stenting, stroke TIA occurred in 3.3%, and combined stroke, TIA, and death in 3.8%. And these differences were statistically significant. Now, this study supports the benefit of TCAR compared to transfemoral carotid artery stenting in the real-world practice, since transfemoral carotid stenting had twice the risk of perioperative events, including stroke and TIA, and stroke and TIA and death, than transcarotid artery stenting. This study also demonstrates the ability to rapidly monitor new devices and procedures using the SVS Vascular Quality Initiative. The next paper that you can download free of charge this month was written by Dr. Catherine Stenson and colleagues from the St. George Hospital in London, England. It's entitled Midterm Results of Endovascular Aneurysm Sealing to Treat Abdominal Aortic Aneurysm. In this prospective single-center study, outcomes of 150 EVAS procedures using the NELIX device were analyzed. This was a high-risk group of patients with 46% having an adverse neck morphology. 25% of the patients had reinterventions, and when the manufacturer's instructions for use was followed, reintervention-free survival at 3 years was significantly better than for those patients who had device implanted outside the IFU. The rates of unresolved endoleaks were low, but 5% of the patients had rupture of their aneurysm after EVAS. 6 of 7 patients with rupture, however, had the device implanted outside the IFU. Aneurysm-related mortality-free survival was significantly better in those cases where the IFU was followed compared to those cases that were done outside the IFU. So the authors concluded that EVAS is successful with adverse neck morphology, and the rates of unresolved endoleaks were low. Secondary rupture, however, remains a concern, especially in patients treated outside the IFU. The next paper, entitled A Comparative Analysis of Long-Term Mortality After Carotid Endarterectomy and Carotid Stenting, written by Dr. Jesse Colombo and colleagues from Dartmouth Hitchcock Medical Center in Lebanon, New Hampshire. 5-year cumulative mortality was significantly higher after carotid stenting than after carotid endarterectomy, and this difference was significant in both symptomatic and asymptomatic patients. Mortality at 5 years was 14% in the endarterectomy group, and it was 18.3% after stenting, with an odd ratio of 0.75 in favor of endarterectomy. And this difference persisted even when the groups were matched using propensity score analysis. So the authors concluded that patients who underwent carotid endarterectomy were 25% less likely to die than those who had carotid artery stenting. The final paper I'd like to present to you is entitled Outcome of Drug-Eluting Balloon Angioplasty versus Endarterectomy in Common Femoral Artery Occlusive Disease, written by Dr. Tzu-Ting Kuo and colleagues from the Taipei Veteran General Hospital and the School of Medicine, National Yangming University from Taipei, Taiwan. Now, this was a retrospective study of 60 endarterectomies and 40 drug-eluting balloon angioplasties of the common femoral artery. 1 and 2 year primary patencies were 97% and 94% after endarterectomy, respectively, and they were 75% and 57%, respectively, after balloon angioplasty. There was no significant difference in complications or adverse events between the two groups. Freedom from target lesion revascularization was significantly better after endarterectomy than after balloon angioplasty. So the take-home message from this paper is that endarterectomy remains superior to drug-eluting balloon angioplasty for common femoral artery occlusive disease. Now, these were our very best papers from the January issue of the JVS. You can download each of them free of charge. To access these, please visit us on www.jvascsurge.org. Enjoy reading all JVS journals and let us know if you have any comments or questions. And see you next time for the highlights of the 2019 March issue of the Journal of Vascular Surgery.